Hey, what's up, world? It's me, your girl, Angela. Welcome to the BTrue2U Talk Show. You know what we do. Before we get started, go ahead and make sure you like, invite, and share, because sharing is caring. So invite your mama, your sister, your cousin, your auntie, and your brother. Honey, invite your daddy, too, because he might get some information. You never know. Y'all, I have my special guest. I love that word special guest because I know these people. I vet them. I believe in them. And I like to call her my doctor, but she's not my doctor by myself. But I stake claim on her, okay? But I'm going to bring to the stage the one and only, the very beautiful, fabulous Dr. Jennifer Mbianda. Hey, Doc.
Hello, hello.
Thank you for saying yes, because I know you're a busy girl.
Not really.
Yes, she is, but nevertheless, before we get into it, I'm not going to say introduce yourself because you've been on the platform before. I'm going to say reintroduce yourself to the people.
Yes. So my name is Dr. Jennifer Mbianda. A little bit about me. I am from the Bahamas, born and raised. Being here in the U.S. for a while, though, I am triple board certified, family medicine, obesity medicine, and aesthetics. I have a practice based here in Hollywood, Florida. Where we manage obese patients, aesthetic patients, wellness patients, and we've expanded now into the Bahamas and hopefully plan to continue spreading the MD Health system. I'm going to call it a system now.
Okay? All the way in the Bahamas.
Yes.
Okay, and you're doing great things.
Yes.
I really see you. I think I've known you now a little over 2 years.
Yes.
And so from the time I came in contact with you and for now, honey, you the girl, okay?
I'm growing and I'm evolving.
You're the thing. And what I love about it is that I find that you're not one of those doctors that just push things on it. Let's talk about the weight loss shots, right?
Mm-hmm.
Just to start off with. They're everywhere.
Mm-hmm.
But I find that people are just going and getting them.
Yeah.
They're not getting tested. They're not getting the results back as far as their blood work or anything like that.
Mm-hmm.
They don't even know to change the doses when needed. And I keep reminding myself, and I tell people every time when they go to you or if they go to you, the difference between you and other people that I see is that you literally sit down to go through the results. You don't just say, bring your results, and that is it. You literally go down every line, and you have a discussion with it. I remember my sister Sheila when she lately came, and she was like, oh my God, Angela, I didn't know it was going to take that long. Oh my God. I said, yes, she's very thorough. And she's like, I love that about you. And so I love that you care.
Yeah, no, it's super important. I feel like, I took an oath to be ethical, and that's what I'm going to do. I was just telling someone today, I was like, I see my patients as my children. So every single person that walks through that door, whether they decide to join or not, like, I have a responsibility to you just as I have a responsibility to my child. So just as I would tell my child, hey, don't do X, Y, and Z because A, B, C, D, and E, I'm going to do the same thing with you because that's how I treat everyone that walks through that door. It's like you're my family. Mm-hmm. So with these weight loss medications, like, it is super, super, super important. Like, you actually need a consultation. And I'm not sure how a consultation could take 5 minutes, but it can't, because you need to get the full medical history of that person to see what drugs they're on. There's so many times I'll see the patient on certain medications that actually causes weight gain. Mm-hmm. Or certain medications, I may have to say, okay, especially the diabetics, I may have to say, hey, hold this, let's tweak this. So all of that is important. And then the biggest thing for me is education. Like, every single thing that I do in the practice, I need to educate you on the information of that drug, all the side effects, all the complications, and what to expect. So I feel like that's like one of the biggest chunks of the consultation itself. And again, the labs, patients, they come in with the labs and I want to see them, I need to see, because sometimes, your doctor may say something to you and you don't really fully understand. And I look at the lab and I'm like, oh, do you know you actually have chronic kidney disease? And they're like, I didn't know I have chronic kidney disease. So, all of that matters. So again, I just think the culture, what we're trying to build is that the patients are our family members, right? You wouldn't treat your family members, the ones that you care about, that.
Any kind of
You
way.
want to keep them, treat them any kind of way. So I think that's the same care philosophy that I have, and I just will always continue to have no matter what.
And there's a lot of medication out right now.
Yeah.
Right? And so, how do you feel about that? Do you feel like it was developed fast, or do you feel like one is better than the other?
Yeah, that's a really good question. So these drugs have been out for like over 20 years.
Oh.
They have been out for a very, very long time. The first one was I'm gonna butcher this one. I think it was liraglutide in 2005, but I'm probably wrong. But one of the tides that actually came out from like 2005.
Oh, okay.
And they've been constantly making new tides. I'm calling them the tide family, and they've been like adding these different peptides to them. So the first ones had just like a single mechanism of action, and now the newer one, tirzepatide, has a dual mechanism of action. And yes, it is true that there are ones that are better than the other, and like you can literally go down the list as far as which ones are. So like the tirzepatide, as the Mounjaro, that's the best. And then second is the semaglutide, like Ozempic or the Wegovy, that's like number 2. And then you go down, and now they actually have a new one that's coming out that's a lot of buzz. It's called retatrutide. This one is going to be a triple agonist. So this one is going to be better than the one that I actually recommend in the office, but it's coming out in like 2027. So that one, the Ozempic and the tirzepatide is like a GLP and a GIP-1, but this one is going to have like a glucagon effect. So at least with this one, there's going to be some preservation to muscle mass, so which is really, really, really good. So I'm super I'm keeping my eye out and looking at the research to see what it's doing. And like right now, they're seeing that patients are losing 24% of their body weight in under a year in the clinical trials with this new drug. That's like bariatric surgery numbers.
How many shots I would need?
You don't need nothing. She right here talking. She looks so good.
I need some shots though.
Yeah.
The last one you was talking about, it's gonna help not lose the muscle mass
As much, yeah.
Okay.
Yeah. So it's gonna be patients are gonna be able to lose their weight better and quicker in a more safer manner. Yeah. So I'm super excited about that when that one comes out.
Okay. So you do weight, and that's how I met you. I tell everybody that's my weight loss doctor. That's my weight loss.
I know I have a lot of names.
But you are a real doctor, and that's what I love. You're not just someone who give shots, you know, because a lot of people just give shots and they're really not. I want to say lack of knowledge and qualified.
Absolutely.
And so I love that about you. But you don't just do weight loss.
No.
So now you're not my weight loss doctor, honey. You're my growing old gracefully, keep it together doctor. Growing old gracefully, honey.
Yes. Aesthetics is also like a big love of mine. And funny enough, someone was asking me like, "Oh, how did you get into aesthetics and all this
I wanted
stuff?"
to know that too.
And I had to think about this, and I was just like, I love beauty. Like, I always been into beauty. Like, as a kid, I was that kid that signed up myself for a pageant in 5th grade, and my mother had no idea.
Okay.
I was just like, yeah, mommy, I'm going to be at the YMCA doing a pageant rehearsal. Just drop me. So I was that kid. So I was always into beauty. And and you just have this like gut feeling. I just was like, okay, I knew that I wanted to go into medicine, but I knew that I didn't want to do like the traditional sense of what medicine looked like at the time. So I was just thinking like there's some way I'm gonna have to combine the beauty with the health, and it just made sense. Going through like my rotations when I was doing my training, I'm like, oh my god, like anti-aging, like this is it, and so that's really where I started to like develop my skills even from residency. And then after I was done out of residency, I even did additional training under like 2 years to get a lot of that skill under my belt.
So you almost, well, not really like a plastic surgeon, because you're a surgeon. But you do the injections and the fillers
and the Botox and the pediotherapy.
And that's new for us, right?
Yeah.
Because I think it's something that maybe the stars did or those that was wealthy, but for the average Joe Blow, these things was a little out of reach. But Doc, hold on a minute. Y'all hold on, we will be right back.
Cancer Has No Boundaries annual event. The event is hosted by the Lewis sisters, Angela Lewis Warren, Sheila O'Brien, and Mary Lewis. The event is in honor of our mother, Willie Lewis, who beat lung cancer, and in honor of our uncle, the late Congressman, John Robert Lewis, who lost a fight to pancreatic cancer. Nominate someone you know that has fought the battle with cancer and won or fighting the battle, and someone who has nurtured a loved one during their journey of cancer. We would love to honor them.
November 1st, 2025. Time 7 p.m. to 11 p.m. Cost $75. Thank you in advance.
Okay, we're back, but you make sure you get your tickets, okay? Get them tickets and hurry up and get your tickets. And don't forget to nominate someone for Cancer Have No Boundary. We are so blessed to be able to honor those that have experienced some form of cancer, who lost someone who dealt with cancer. So please get your ticket and nominate someone. Even if you don't want to come, support someone else by sponsoring a ticket, okay? Now, Doc, we back. Okay, listen. We was talking about how I felt like it was not the average black woman thing or reachable. Tell me how you feel about that.
No, it's so true. I feel like I'm now having to educate the black women that are in the practice. I think because we just felt like, okay, maybe these services were too expensive, or maybe too out of reach, or maybe, like we were talking about, the imposter syndrome, maybe I'm not worthy to get certain things, certain services, or maybe even thinking that, you know, maybe if I do this, I'm too vain, you know. I think there's so much to like unpack there, or like, okay, I should be taking care of my family, or X, Y, and Z. I shouldn't really be doing this for myself, right? That whole black women, superwoman, we got to do everything for everyone else except for ourselves. I think a lot of that, as I'm trying to like dissect it, stems from that.
You think they also feel like if I get this, it's saying that I don't love me because I'm doing something to myself, and you're supposed to just accept yourself as you are. Like, just grow old, wrinkled,
and then also the biggest thing, I think, the misconception within the black women community is that, okay, we age so gracefully, and that we don't have these lines, we don't need it. I'm gonna do it when I'll do it when I turn 60 then. So I think that is like one of the, if I have to like list everything down as an order of why I feel like we don't partake in these services, that would be like, I think, the number one thing, like the misconception that, you know, because we black, we don't crack.
Yeah, I could see that too. Well, honey, I'm black. And I cracked up. I'm glad that you know, cause I'm 57 now, and so I can look, you know, I don't look bad.
You look good. What you talking about? You don't look bad.
But when I lost weight, remember when I lost weight and my face fell in because I lost the weight?
You lost a lot of fat in your face, a lot of volume.
Yeah, so things like that is, we just don't realize we need to invest in ourselves, right? We buy a handbag, we buy a pair of shoes that's going to lose its value. Sometimes we don't even carry it, right? But we show up with our canvas every day. So why not put your money or invest in yourself?
Yeah, no, it's true. It's true. Like, it's a lot. It's a lot to unpack there. And like I was sharing with you, I just think like sometimes we just feel like, you know, let me make myself small. You know, let me make myself small. I shouldn't do these things because I just need to like fit into this certain space and mold that I feel like society kind of has for us, which is that you're supposed to be, you know, struggling to take care of your family and do everything for everyone else. You shouldn't like put that self-care for you. Like, I think that is one of the biggest challenges that we face as black women.
I like how you said earlier too. We feel like if I do that, then am I vain? And having a conversation with you, sometimes we play small.
Yeah.
We play small. I feel like because we don't want to be judged.
Yeah.
Or we don't want to look shallow.
Absolutely. Like, so personal story. Like, so my husband bought me a luxury car last year. I refused to drive that thing. I am now, because remember 2025, I'm evolved. I have evolved. It's not the thing, it's the new thing.
You eat now. You eat every day when I come. You eat.
2025, my whole outlook on life literally changed, but it was because of a lot of traveling that I did, and there was certain people that kind of just came in, and I was just like, whoa, what am I doing?
Yeah.
And literally, like, I refused to drive this car. I just kept driving my old car. And I'm trying to unpack that today, and I'm just like, whoa, why was I just feel like I had to, like, reduce myself, you know, and not drive my car.
Yeah. Did you feel like, I don't know about that.
That's crazy. I would not. And he literally was like, why are you not driving your car? And I was just like, I don't know.
You earned it. You work hard. You got, what you say, double certified?
Triple.
And so you earned it.
I know. I don't know. But I mean, now I know, again, because it was that same mentality, you know, trying to
play small.
Trying to play humble, right?
Yeah. Not that you're not humble, but you don't want to be looked at as superficial, or
vain, right? Like, okay, she's just into material things.
But what's wrong with it?
I know. That is the thoughts of the past.
Okay, because when I tell you, honey, when I walk in, I don't go that regular, but every time I go, or if I go with my sister, I be like, dog! You are the example of what you're giving, right?
Yeah.
And you need to be the first partaker of it. And when I say that, I'm just talking about self-esteem. I'm talking about putting yourself together. And I think a lot of us women, like you say, we invest in everybody else, but not ourselves.
Yeah.
Like this year, starting the end of last year, November, December, I started taking myself on a solo date.
Oh, how's that?
I love it. It is the best thing I could have ever done for myself. I was 56 and I had never sat down in the public and ate by myself. Never. And when I did it, I was like, why I never do this? And it may be something simple to other people because they do it all the time.
Yeah.
But to be able to spend time with yourself and then start valuing who you are.
Yeah.
And I think this is what we need to know, that these things is just you valuing yourself the more.
Yes, pouring into yourself, like, it's super important without any other external factors, without the kids, without the husband, just you actually loving on you and just feeling that confidence. Like, it's super, super, super crucial. So whatever things that you kind of need to do to boost that, to boost that feeling on the inside, and then also boost those things on the outside, it makes you turn and transform into the woman that you always kind of like wanted to be. And so, like, that's kind of like where I'm like walking into that, you know, that same philosophy, you know. It's and funny enough, like, I'm about to start doing that same thing again. Before I got married and before I had kids, I used to take myself on dates.
Oh yeah. And I put my face on and I take myself to the movies. Now you can't tell me nothing, dog.
Yeah, no, because it's something about when you look good and you know you look good, you just feel good.
Yeah. And you're not doing it for anyone else. You're doing it for yourself.
You're doing it for yourself. Like, when you just get your hair done, like, no one can talk to you. Like a whole new person.
Trust me, I see it when people sit in the chair, the way they come in, and by the time they leave, I be like, y'all get a whole different attitude once y'all get your hair done.
Seriously, it's like an antidepressant.
My dad used to always tell us that every time we were sick, he'd be like, get up, put yourself together, you'll feel better.
Yes, you will feel better. It's true. And it's the same thing with this aesthetics. It's like, don't listen to the noise on the market. Do what's going to make you happy.
I was listening to you say you didn't realize you was playing it small until you start traveling.
Yeah.
Do you think it's because we're not used to seeing it?
Yeah. Absolutely. Absolutely. I think all I saw was small. Like all I was surrounded by was small until I like peeked out and I was like, oh, that's how they doing it over there? Oh no. Time to switch this whole thing up.
And I think that too, like some of the ladies that do it, maybe they do it like in secret. You know, like I call them gatekeepers, right? They're doing things, but they're not sharing. They want to, oh no, this is just who I am. Oh, this is just how I look, because I don't know if it's shame or sometimes it's just something that they're just not used to seeing, so they don't want to be judged.
Yeah.
Like I'm thinking, like the people in my circle, they're not used to me hearing women say, I'm going to get Botox. You know, so that's like, what you getting Botox for?
Yeah.
Because I don't want to be frowning when I talk to you.
Right. You don't have that deep permanent crease, you know, when you get older. That's why.
Yeah. And I share it. I share it with a few of my clients, and they partake in it, because sometimes you don't know until somebody show you.
Yeah.
And so I think it is so important.
Exactly. And you know, when you just said that, something just clicked to me, because let's say if all of your group of women, right, and they had this mindset of, okay, we shouldn't be doing this, we shouldn't be doing this. Like they say, if you're in a company of 5 millionaires, you're going to be the 6th millionaire, right? So if you're in a group of women that are like, oh, what's that? So that is also one of the biggest reasons probably why we play small. Or like we're like, oh, you know, if I do this, you know, Sheila gonna say this, or this one's gonna say that. So sometimes changing your environment and also like stepping outside of your comfort zone and seeing what others are doing. So it's like, okay, there's nothing wrong with this actually. You know, this is something that I want to do. I shouldn't have to shrink myself, right, in order to not do it.
And so as I listen to you and we talk about wellness, right, health, mentally, mind, body, and soul, healthy. And so I think a lot of things do stem from our our process, how we process things. And so how do we break that barrier?
One, I think some strategies is reading. I think reading a lot of books that have women that kind of went through the same challenges as you would have, that helps. Number two, like I'm trying to get into this meditation thing. It is like, it's hard because I feel like with everything that I have going on, it's very hard to like silence my brain even down to a minute, but that also helps to just everything flows down. So those are the two strategies that I would give anyone if you're trying to like, okay, let me get my head right, you know. Of course, that's praying to God. Like that should be number one. Right? That's number one. Let's just recircle that number one. Pray to God.
Because when you said meditation, I could just hear people say, "Oh, she meditate." Yes.
Oh, yes.
The Bible even tell you to meditate on the word. So not saying you're meditating on any other God, but you're just saying being still and quiet.
Being still and quieting yourself and just kind of like listening to your breath, listening to your body movements. It has like transformed a lot for me when I'm able to do it, and when I am not doing it, I feel very chaotic and very overwhelmed, like extremely overwhelmed. And then I could feel my body saying, okay, like you're about to explode. It's time to like slow it down. Slow it down, meditate before you start your day, right? Yes, there's a prayer, but there's also a sense of stillness of your mind that is super crucial, that would help you go a longer way. And again, I think that's something too that's not in Black culture.
Yeah, my sister like to say, Sheila, your new patient, she like to say breathable moments. And you just like in the midst of your day, maybe an hour later during the day, 2 hours during the day, as 2 hours pass, every 2 hours, every 4 hours, just literally stop and breathe. And she talks about how much that keep her still, and it just help her come back grounded.
Oh my gosh.
And so it is so important to just something so simple. It's
just breathe. Like life is a lot. Everybody is going through something, right? Like things are coming at us at speed of light. And I think the biggest thing is that you have to like understand your body and just understand when things are triggering, right? When you start to feel your heart starting to fluster, or you start to feel you're starting to press, like you're starting to get hot. Like those are like signs of, okay, I'm becoming anxious, right? I'm becoming overwhelmed, and just saying, stop. be still, reset, whatever you were going to do in that moment, you probably wouldn't even do it well anyway, right? So using that 5 minute of stillness to getting your mind right is like super crucial. Yeah.
That's important. Get your mind right, because you know everything stems from here.
Everything stems from your mind. Like literally you schizophrenics, they tell their mind that they have 3 personalities. Like the mind is so important. Bipolar people, they think, you know, they can become president, and they sure start acting and doing stuff.
And they did.
We ain't gonna go there, Lord. We ain't gonna go there, Lord. I ain't say a thing, but y'all know. But it's true. Like it's true. Like it. Like, and if you tell your mind that you can do something, like you are going to do it.
Okay, so listening to your mind is important, and the next thing that I notice is the gut.
Ooh.
So let's talk about that.
Gut health. Yeah. That's my new phrase, gut health, because I'm a gut type of woman.
Help me become one, doctor.
What you mean help you become one? You know how to go. So what happened? Let me now. I'm the questionnaire now. I'm the interviewer now. So why don't you think that you're not listening to your gut? What do you think?
This week I have no choice but to listen to my gut. But I know I don't put the right things in my gut, right? And so that is such a hard thing for me, because first of all, I know flat gut starts in the kitchen also. But even with knowing that, as far as sticking to that, it's a struggle. So I need to find out how to unlock that, right? So I can get to the place where I can have a healthy gut. Because a healthy gut would cause me to have long life as well.
It's true. It's true. It's true. It's true. We gotta unpack that.
Yeah, and I know it. And it's like, and I know it. But I still reach for the wrong things. And I don't want to make it an excuse, but I think a lot of it has to do with me being allergic to so much. You know?
That is hard.
And so I stick to what I know, although what I know is not good for me.
So when you get the diarrhea and all that stuff, that don't help.
It should, right?
It should, because normally that's what do it. You know, like, you know.
Well, listen, it doesn't matter. I don't eat cheese. I can't eat rice.
I know.
Can't eat string
That's why I don't even like to treat you. You know I don't like to treat you.
Don't say that.
You know that. You do know that.
Yes, unfortunately, yeah. It is so hard for me to get an appointment with her.
But you know what? I'm going to have some good stuff coming your way real soon.
Okay.
For some good gut health stuff. Don't worry. I got you.
You got me?
Okay. Listen, I got her. I got everyone. Don't worry. Okay. No, it's hard. I think it's hard to form healthy habits, eating habits. It's tough, and I think that you have to know who you are. Like, I'm a type of person that, listen, I'm Caribbean, so I know once I even touch a rice, is over. It is over. I'm gonna be eating rice all week. So I just don't eat rice
at all.
I
barely.
Not like I don't even barely. Like if I go to my in-laws, you know, they're African. That's kind of tough, but I'm not around that all the time. And unfortunately, I don't get to cook anymore because, you know, I just don't really get. I'm busy. So I literally just eat like meat, like my protein meat and veggies. Yeah, but it's just training now. It's a trained type of, it's a trained behavior too. And then I think for me is what keeps me going is I'm big on, I have to practice what I preach.
Yeah, I was gonna say that you got.
Yeah, I have to practice what you. I can't be telling you.
Yeah, I seen them salads you be eating.
Like today, like today, literally all I had my chicken, I had some like barbecue chicken, and then I had like some turkey links. Like that's what I had today. I'm literally counting my protein in my head as I tell them. I do, and I encourage you guys to count your protein.
I'm a bad patient because I've never.
Oh, you gotta
count it. Protein.
And that's why patients are tired on this drug, because you're not eating enough. It's not the drug, it's you.
Okay.
You gotta eat the protein. Everyone's body is different, right? So there's a certain amount of protein that your body should require versus what my body should require, and then the other factor in that is like if you're moving your body, because you can't put too much protein in if you're not moving, because then again that'll make you feel sluggish. but it's just showing up every day, trying to choose the right options.
Don't be breaking your
You know, choosing the right options is not, it's not to say like you can't live. Again, you just have to know who you
Balance.
are. Yeah, you just have to have some balance. Like if you know that, okay, if I'm cheat and I eat this thing, are you that person that could now go back the next day into your routine? If you're not, then that's when it becomes a problem. But if you're super disciplined with saying that, okay, if I cheat, I'm good the next day, then it's okay to have your cheat day. And I am not perfect at all. I actually am more disciplined with my eating than my working out.
And I'm the working out than I am. And I feel like I have to work out harder because I eat so horrible.
Yeah, because it's literally like the ratio is like 70% of what you eat is more what you eat than what you do. So for me, my challenge is actually like moving my body. That is where my habit that is where like personally my habit of like staying to like a routine is tough.
Okay.
Yeah, it's tough, but we're working. Where
Rome
Rome wasn't
built
building
in a
today.
We're a work in progress.
We're a work in progress. So every time you reach for something, I think the next thing that you should think about is, okay, what is this going to do to me?
It'd be
Is
after
that
I ate it. No, it'd be afterward. I'd be like, dang, I know I shouldn't have ate that.
Really? Okay, what
I kid
about
you
like
not.
that split second when you're about to go and get it? Like, is there like a
It
pause?
is- No, it's a block. It's not until afterwards. And I'd be like, in
A
the midst of-
complete block?
Yeah, I don't even think about that until after I got it and eating it or don't ate it. And I'd be like, dang,
For real?
I promise you. Hear my hand. I
There's
wouldn't lie to
no pause to be like,
No.
Well, how about you create the pause?
I don't know to create the pause.
You could create the pause.
How create the pause?
Now you have to. It's an intentional process. So the intentional process is now going to be when you go to reach for anything, like anything, you stop for 3 seconds and say, "Is this going to do my body good?"
I was thinking I'm gonna put sticky notes around on stuff.
That helps.
That's what I was thinking I would do.
Visual, anything that'll help. If the pause, if the mental pause is not gonna work, then put a big sticky note on your fridge, like make good choices because this gonna hurt later.
Yeah, don't do it.
Don't do it.
Don't do it.
Whatever you need, put the sticky note there, like for real.
Yeah, I'm gonna work on that part. Okay,
Gut health.
Gut health. And so listen, you do everything, right?
What do you mean?
Like you don't just do the Botox. You don't just do the weight loss. What are some of the things that you do that you find to be, you can't count everybody's pocket, but pretty much feasible that we can start off with?
Yes. So I mean, I think in general, because at our practice, because we're not really offering primary care services right now, I still have to educate, whatever audience that I'm in, is that preventative health care is always number one. Like, prevention is better than cure. So wellness for me starts off on prevention. So getting your mammogram, getting your pap smears, getting your colonoscopy, like that is without fail. Now, once we got all of that and you get your routine screening blood work, which is like your cholesterol, checking your kidneys, your liver, your thyroids, checking to make sure there's no issues with your diet, like any risk factors for diabetes. And then that's when I'm like, okay, that's where now the wellness come in. What are some of the vitamins that you may be depleted on? As Black people, we're like severely depleted in vitamin D. That's why all of us were out here walking around tired, right? And so I think another big thing that we don't realize is that yes, we can ingest the vitamins orally. They're great, but then getting the vitamins through IV or through the muscle is also like another better way of getting those vitamins in.
Book me for that. Book me for that.
I already told you I ain't doing that. She know that all of her, she got 20 million allergies. I am not about to have no EpiPen and steroid. We're not doing it. No. But like these vitamins, like they make you feel real good. Like the different boosters that we have. I know. I think was it you that came in asking about NAD and all these? Yeah, no, we ain't touching it with a 2-foot pole.
I should be able to do something like a patch,
a muscle one, but Did we do the glutathione with you?
Is that the one that supposed to help me with my?
It'll help with the skin, and it helps lighting up the skin a little bit as an antioxidant.
Yeah, we tried it,
but then what it didn't really. But
that's
they
why
tried
I told
to
you to give me IV. That's why I told you to give me the IV.
I know, and I just was not. I am a safe doctor, y'all. I ain't having it.
You want to think about it?
Not think about it.
Okay. Hold on, y'all. We'll be right back. Hey, y'all. Hey.
Hi, guys.
You know, while we're here, we got something to say, and that's about July 18th and the 19th.
2-day retreat.
You do not want to miss this, honey. We're going to teach you how to take your glam to the next level. We're going to pamper you. We're going to take care of your mind, your body, your spirit, and your soul.
This is our Gracefully Growing retreat, which is going to be all about self-care.
And listen, we're going to feed you. We're going to feed you Friday for our meet and greet. We're going to feed you breakfast. We're going to feed you lunch, and that is not it.
And you do not want to miss Saturday night, the gala.
And dress up, baby, because get ready for the camera, because you know how we do it.
Okay.
And it is only
$125.
That's right, $125. And you can get your ticket by Cash App of me at 954-298-0183. That is 954-298-0183.
Or you can Cash App me at SD O'Brien, OBRIEN 66.
Get your ticket, girl, because you don't want to miss it.
Bye.
Okay, we're back. Now, you make sure you get your ticket now for July 18th and 19th, Gracefully Growing, because she going to be there in person, so you can ask some questions, you can get to meet her, and you can get more information on details. So don't forget to get your tickets. The last day to purchase your ticket is July 10th, so make sure you get your tickets for the 18th and 19th, Gracefully Growing. Now, Doc.
Yes.
I met you because I was 173 pounds. I am 5'1".
Were you?
I was 173 pounds. I got down to 139. You
That
know
was
your husband
small.
liked the way I look.
Yeah,
but,
we like it.
I still want to get to like 145, but it's not about me. Let's talk about obesity. Like in our community, you know, and sometimes I think we're delusional of what's considered to be obese, right? We think you're only obese if you're like 500 pounds, but obesity got a lot to do with your body.
Ooh, so this is like a little testy topic for me, because right now, like the only classification that they have for like obesity terms is BMI.
Right.
But BMI is your weight as it relates to your height.
Right.
Now, this formula that they decided to design was all the way back in the day by white men. They didn't account for a whole lot of stuff when it comes to like weight, right, and obesity. They didn't account for muscle mass. They didn't account for bone density. And as Black people, we just are heavier. We have heavier muscle and we have heavier bones. So on this BMI calculator, we're actually will always be higher than our like white counterpart. So that's why when I'm seeing my patients and I'm doing the consults and I'm saying, okay, your BMI is X, Y, and Z, I always say, okay, this is the number, but I look at the person too, and I can just tell, like you can always tell when someone is just very, very muscular, right? And I take it down a notch to say, okay, this is like a little bit of an area here, like you're not that morbidly obese, you're just very, very muscular. So that's why I kind of like shout from the mountaintops when it comes to that, because again, because I am a Black doctor, I am going to, you know, I advocate for everyone, but there's certain things that they didn't take account for when they were doing a lot of things in medicine and putting these things together that I have to like educate us on to say, hey, take it with a grain of salt.
Gotcha.
Yeah, but in terms of obesity, right? As being overweight or not being that healthy size, that is a thing. I think that now with the advent of these new medications, it is highlighting so many things that we did not know. So back in the day when you went to the doctor and they said, okay, you're overweight, you're obese, the first thing they said was just go exercise and eat right, and that's it. Like that's all we told patients at that time. And then they would go exercise, and well, some of them some of them would exercise and eat right, and then nothing would happen. And we were just thinking that, oh, you're just greedy, you just lazy, you're not really following our instructions. And then these medications come along, and these same subset of patients that were eating right and exercising and couldn't lose a pound, now they get on these drugs and now they're losing weight. What did that tell you? That tells you that obesity is not just a willpower thing or just the, okay, exercise and eat right. It's a hormonal aspect for a lot of patients. And that's why these drugs are like creating such a big buzz, because we did not really understand this part, you know. Like, and it's true, like the patients are not lying, they were eating right and some of them were exercising, so there shouldn't be no way now that your hormones are now better and you're able to lose the weight.
When you say hormone, I'm thinking about menopause, right?
So there are tons of hormones that these medications we're now seeing that they act on, and now that we're seeing has a role in obesity. So yes, the estrogen is another one. The menopause is another one, and that's because when you're menopausal, your estrogen levels are low. So when your estrogen levels are low, you tend to have more fatty tissue, and it likes to target the midsection. And that's why we're seeing with these drugs that menopausal patients are just doing so much better, because there's a certain hormone that has a ripple effect on estrogen, and is causing these classes of patients to have better hormones and now better weight loss. Yeah, and that's why you see menopause patients, like they're literally coming just for like the improved symptoms that they're getting, the hot flashes, just that, you know, the mental fog or that dragging feeling, and then they're getting on the drug and they're feeling so much better. And it's just not only like saying, okay, now I've lost weight, now I feel more confident. No, it's more to it than that. It's more, it's a reason why the hot flashes are just no. Yeah. And again, yes, weight loss can cause you to have less hot flashes, but in the past when you were doing it, your hot flashes were not as reduced as it is now. So there's something deeper.
Okay.
Yeah.
Yeah, because I know when that menopause, honey, everything just want to go out of whack. And I can say that as far as me too, as far as helping me with my menopause, because it also craved my the sugar. Helps me crave the sugar, and that sugar was causing my hot flashes to be worse. And so I love that about it. But I love that this drug is like all around good for something.
Yeah, it's all around good for something. And now we're seeing that it's acting on inflammatory markers that are in the whole process of osteoarthritis and rheumatoid arthritis. So like we're seeing, like even before the patient gets down to their like weight loss goal, they have like less joint pains and less flare-ups, because traditionally for osteoarthritis, the main thing we say is weight loss, and then they actually have to get down to their weight loss goal to get the benefits of the less pain and the less flare-ups. But now on the drug, you're seeing that much earlier on. Again, that's telling you it's just not the weight loss part. It's something else that this drug is doing that's combating that. And again, it's because now we're seeing it's acting on these anti-inflammatory markers. But again, there's more research that's going to come along with these, with these drugs, because remember, they just was thinking about diabetes, originally, but there are so many other benefits that we're seeing, and that's why I just feel like I need to just be an advocate for it, because I get so many patients that come in, one, they're ashamed of being on the medication because such of the taboo nature of it, and then I had other patients. Yeah, I mean, because I think the whole celebrity, I don't know. I really, I don't know. I think weight loss in general is a taboo topic, so I think that's number one. People think that, oh, you need to be doing something the natural way, and it's not really the case, because some people, like, they just can't. That's just their body. And then I think the celebrities, maybe they were using it, and so now that's a taboo. But hey, they had hormone problems too. Let them be, you know. So I think that's why it's, you know, it's a taboo. And then they're like, oh, you know, I felt so ashamed, but then I saw this documentary on Oprah and this doctor talking about it, and she was talking about, you know, the food noise and all these different benefits. I didn't even know that. Like, I just keep hearing, I didn't even know that. And so to me, I'm thinking this is common knowledge. I'm not gonna lie. I was thinking this was common knowledge. That's why I like never really used to post on my Instagram or socials about it. But now that I'm hearing that same phrase, I didn't even know that. So now it's like, okay, I've now taken on this oath to like spread the right information. Like, I'm going to spread it. I'm going to educate the people in our language, the way that we understand. And I'm just going to continue to be an advocate about, you know, obesity and hormones and gut health and all these different things that we need to know so that we live a better life, because that's what it's all about at the end of the day. Like, you know, we live on a day-to-day basis, and we really don't think about, you know, 30, 50 years down the line. But if we just put certain things in play, like we put in as, you know, retirement or 401k, all these different stuff to add up, it's the same thing with your health. Like, if you don't have health, you don't have anything.
That's true. That is so true. And I do think too, one, it's a lot of shame behind it. Two, I think people just gatekeeping. They want people to feel like I'm losing weight because I'm exercising when you ain't. Okay. I mean, you may exercise a little
but
bit.
they're getting a little
help.
help.
Okay, help your sister out that you see that, you know, somebody is constantly complaining about her weight. Help them out. Share the information. I love to share you, and I wasn't ashamed of anything that I did with you. But I want to talk about, as far as I know you do, we're talking about women. I know you you always talk about that, but men can use your service too.
Yes, right? Yes. I just like posted a before and after of a male patient on the like our MD Health page, and they're like, I didn't know men can do this, and I'm like, weight loss is not gender specific, okay? Like it's not like, and again, this whole concept of vein and thinking about like the abdomen, because like if you look at the picture, like he had a big abdomen and he was like all flat, and it's not even a matter of vein. Like when you have a lot of fat in the midsection, this increases your metabolic risk. Metabolic risk meaning you have more increased risk of high blood pressure, increased risk of cholesterol, increased risk of all these different A1, diabetes, all of this pouch
tells it all.
Increases your risk of those conditions. So men, right, you see also men, right, they have, you know, they have the big gut, right? So yes, they do benefit from that, so that they don't get these different metabolic diseases. So it's all one and the same.
I was thinking that too, like, you know, certain people can use this. And I remember thinking when I was getting the shots, and Woody was going to get the shots at one time, and we talked to his heart doctor, and he was like, yeah, this is a good thing. And for the heart doctor to say it was a good thing, I'm like, I wonder, do other men think about getting this?
They don't, because again, that taboo, and they think it's a vain thing. It's not a vain thing, it's a health thing. And you know, these medications are now being shown to increase cardiovascular diseases. So again, it's not just a weight thing, it's a health thing. Okay. Yeah.
Well, this was good. I can't wait for the people to get the chance to sit and literally talk to you. July 18th.
July 18th, I'll be there.
Okay, from 6:30 to 8 now. Don't miss it now, because we ain't going to be playing. Don't miss it. But, Doc, please be so kind to look into the camera and tell the people how they can connect with you.
Yes, so you guys can connect with me on Instagram, TikTok, Facebook, on the clinic page at MD Health. That's EMDI Health. Or you can connect with me on my personal page. That's Instagram and TikTok, Dr.JMBIANDA. If you're ever curious about starting our program, you can give our office a call at 786-559-7005. We have like tons of programs, and the process is super easy, super simple. Our scheduler, she's awesome. She's great. Just say I sent you. And that's where you find me.
Yeah, Kimberly is great.
Yes.
So if you had one thing to tell the people as far as the weight loss or the beauty aesthetics, what would you tell them today as far as, I don't know, investing in themselves or something?
Yeah, I mean, I think I would just say don't be ashamed. Do what's right for you. Do what's right for your health, and don't make yourself small. Do what's right for you.
And it's okay to shine.
It's okay to shine.
It is.
Step on through.
It is. I tell people,
It's
I
okay
say,
to
I'm not
shine.
dimming my light anymore for
Yeah.
anyone. Don't dim your light.
Don't
It is
dim your
okay to shine.
light. Don't dim your light. It's not, it's not a fad. Don't have any shame, right? It's not a you thing. It's your body, right? It's your body. So sometimes you just need the help, and it's okay.
Okay? It is okay to get some help. Holler at my doctor. She's not my doctor by myself, but nevertheless, holler at Dr. Mbianda. You would not be disappointed. I love her bedside manner. I love that she cares. I love that she's full of education, and not only that, she wants to share. She wants to help the community. And so don't just go by yourself. Honey, bring your husband, okay? Bring your husband. Anyway, y'all, thank you for joining us. See you next Monday at 7 p.m. Remember, this is your girl, Angela, and everything you do, always be true to you. I love you, and I mean it.